If you're prone to epilepsy.
For now. And then we'll. All right. CBR. That's the next slide. Don't look at that.
What is it?
All right.
It said nothing.
So, toxical chemical agents. Chemical action on life processes causes death, temporary incapacitation, permanent harm to humans or animals. Chemical warfare agents are toxic chemicals and their precursors, prohibited by Chemical Weapons Convention, includes nerve, blister, blood, and choking agents. So blister agents or vesicants produce casualties, degrade efficiency, restrict terrain and equipment, fluid-filled blisters. So blood agents or ACs, which are hydrogen cyanide, CK, cyanogen chloride, SA, which is arsenide. Choking agents, characteristics are they attack lung tissue, pulmonary edema, dry lung. Thank you, Clark. Dry lung. Non-persistent, field protective mass, two choking agents are built to significance for. Can't pronounce that word so much. Okay? But you read on the screen. I'm guessing it's phosphine or. I'm gonna go with that. So stop breathing. So we have the NAAK-MK1. So in case you ever have to use this, you're gonna stop breathing, close eyes, dawn and clear mask. You're gonna pass the alarm. All right. You're gonna remove the NAAK-MK from your carrier. And then you're gonna hold with non-dominant hand. You're gonna check your injection site for no obstruction. So the injection site, when you're injecting this, you wanna look for the medius part of your body. So for some personnel, it's probably gonna be your buttocks. Some personnel might be your thighs, okay? Just the medius. For me, it's the bicep. Oh. All right. So you're gonna grasp I'm sorry. Grasp the injector with your dominant hand. Do not place the finger over the needle. Position green end against area to be injected and apply even pressure until the needle penetrates the skin. And that's, again, you gotta go through that suit, through whatever layers you might have, or should have layers over there. Whatever other layer you have there. You're gonna have to forcefully do this, okay? Hold the place for 10 seconds. Do not jab the needle to make contact. And then remove the injector. Place use injector between pinky and ring finger. Pull 2 PAM CI 1 out of plastic. Yeah, that one. All right. Again, when we are going to a place that we are going to be issued with tasks to bring this gear with, personnel will get more in depth, more thorough training to make sure you know exactly what these every piece of equipment that's going to be in this bag that are, okay? So that builds that. Place use injector between pinky and ring finger. Repeat steps 2. Attach injectors. Perform decon if required. The decon is decontamination. We're going to get further into this in the training. So you're going to don mop before it's not protected already. You're going to wait 10 to 15 minutes and monitor for symptoms. Seek help if symptoms are not removed. I will seek help even if you have to dress. Okay? All right, so demonstration. I'm just going to use the slides. So, in case someone is down, the system. So ensure the casualty is masked. So their words, okay? Check casualty for previously administered NAC MK1. Ensure that personnel is masked. Retrieve casualties remaining NAK MK1 injectors. position casualty on their side. You're gonna administer the maximum of 3. So when after someone is injected once, they should have these in their back, so you should be able to see that how many of you inside. They don't give it 3, so just use the rest of them. That's only 3. So if you go in there, they don't have any left. Don't grab one of yours and give it to them. Decon skin with RSDL if necessary, and administer Canna if necessary. Position casualty. Apply pressure, forcing air out on their back. What you're gonna do is lift them up by the jacket, drop them again. Yes, I know. But that's what you're gonna have to do. So lift casualty 18 to 24 inches from the deck. Don't get damaged. And you're gonna repeat this 10 to 12 times per minute.
I can't take it back. I need somebody to
Biological agents. U.S. biological warfare policy. Established by President Nixon on November 25th, 1969, it is unconditionally renounced all methods of biological warfare. So defensive research only. Toxin weapons was banned on 14 February 1970. Stocks were destroyed by 26 December 1975. The Geneva Protocol of 1925 date. It was signed in June 17, 1925. Protocol for the prohibition of the use in war of that word, poisonous or other gases and bacteriological methods of warfare. First multilateral agreement to prohibit the use of biological agents was signed by 108 nations. So introduction to decontamination. The methods of decontamination are based on tactical situation and logistical assets available. Neutralization, physical removal, and weathering. Methods of decontamination continue. Neutralizations, the adding of other chemicals to the contaminating agent to make that agent less toxic or non-toxic. Physical removal includes relocation of a contaminating agent from its current location to a less important or safer location. It doesn't always involve rendering that agent less toxic or non-toxic. So weathering occurs when the contaminating agent is exposed to natural elements. Agent hazard reduced or eliminated. Simplest method of decontamination, often the preferred method. So standard, non-standard, and natural, or the types of the contaminants. The standard decontaminants for items is assigned to units equipment list. Includes M291 SDK, M100 SDS, super topical bleach, calcium, soap, and detergents. Non-standards are field expedient materials and commercial products. Includes household detergents, bleaches, caustic solutions, and lye. Natural decontaminations, they are not chemicals, generally, includes water and steam, earth, time, burning, and weather. 3 levels of decontamination. So immediate, basic level survival skill, which minimize casualties, help limit the spread of or transfer of contamination. Operational is it removes gross contamination, reduces contact hazard, limits spread of contamination. Thorough reduces contamination to the lowest detectable level that the unit can achieve, allows for a reduction or elimination of MOP. 2 major categories, permeable and impermeable. Permeable protective clothing allows air and moisture to pass through. Examples are the J list or JS list. The Navy uses protective overgarments. Often referred to as MOP gear or MOP ensemble. 4 components: JS list suit, field protective mask M50, overboot, lightweight chemical protective alternative footwear solution AFS, and chemical protective gloves. So protection capabilities of the JS list suit are provides protection against chemical agent vapors, liquid droplets, biological agents, toxins, radioactive alpha and beta particles. JS List has a service life of 120 days from when the package is opened. The suit may be worn a total of 45 days. The 45-day wear time does not need to be consecutive. The 45 days of wear must occur within 120 days service life. 24 hours of protection after contamination from chemical agents. Protection provided significantly degraded when in contact with petroleum, oils, and lubricants, body fluids, insect repellents, water. It's not designed to be decontaminated or re-impregnated, disposed after exposure to chemical agents. May be laundered up to 6 times during its 120-day service life. Should not be doing that. Has a 5-year shelf life and a 15-year hold. Then we're going to talk about alarms and warning signals. Early warnings give others more time to react. Give the alarm as soon as possible. Use an alarm method that cannot be confused. Repeat the alarm. Supplement if possible. The 4 types of alarms, warning signals for warning personnel of an attack are vocal, visual, sound, audio, visual. So vocal, which is chemical, are going to be spoken word. So it's going to be mask first, then pass along. So always get yours on first before you go running around screaming, letting people know, put it on their mask, okay? Vocal radiological is going to be a fallout. Radiological monitor, increase in dose rate to 1 CGI per hour. So actions, this is going to be repeat the alarm, seek shelter or overhead cover, protect respiratory tract. Vocal chemical is a spoken word, mask first, then pass forward. Gotcha. Visual. Used with vocal alarm, reinforces warning of hazard, standard hand and arm signal. Seen it before. Visual. You're gonna just bring your arm. You're gonna just make sure they see you. They see you going crazy over there. You got your mask on. They don't. Hopefully they recognize. I should probably put my mask on too. Sound. Reinforced vocal and visual alarms. Rapid continuous beating on any metal object. Sound. Battlefield noise may require louder alarms. Succession of short blasts from vehicle horn or other suitable device. Ratio of 1:1. Interrupt the 10-second warbling siren. Audio visual. Automatic chemical agent detectors. Visual flashing lights or auditory loud beeping. Personnel seeing or hearing this alarm mask and augment to warn others. So that's that vocal visual, they keep passing it on as they see it. So this is a joint service general purpose mask.
Sleeping.
So it's designed to provide 24 hours continuous head and eye respiratory, chemical, biological, radiological particulates, and toxic industrial chemical protection. Improve overall mission performance of the warfighter. Extended beard allows for better protection of the neck area when wearing the protective ensemble. Size and tool. So it comes in small, medium, or large. Okay? So this is one of the things we do the CBR fittings. That's when we have all these bags, we know your size already. So when you are designated for that personnel that will be tasked with going on a mission, where we have to bring this gear, your size will be pulled up, and we will make sure your size is available at the site. Okay? Certain personnel have to have special sizings that we do not. They do not have on site. So those personnel will be grabbing their own personal masks, bringing it to the sites with them. And we'll give them a checkout thing for to make sure we know you're there. Currently, there's only one person in the man that has their own personal size thing. So when that person, but if we get more people that has the same thing, make sure you get your gear, take it with you. Take it alert the person, coordinator on the other side that person has the size. Applications. Special operations is going to be M50, shipboard is M50, fixed sites are M50 as well as ground. Ground vehicle, interior and exterior wheel and track vehicles, they use the M51 because they have a specific attachment that is contained. When issued a mass system, you should receive mass carrier, the mass carrier, individual equipment carrier, that one will be issued, so I have that here. Face piece assembly, a clear outer with outer pouch. Those are, it's going to have all your chemicals, all of this to stack and stuff. So that's required. Have warfighter place the palms of the hands over both M61 filter inlet, M61 filter inlet ports and breathe in. Mask should collapse against the face and remain collapsed while holding their breath. If it does not, the fit is, if it does, the fit is correct. But if it does not, try to do it again properly. If that doesn't work, then bring it, you need a new size. Hands must cover the entire inlet area. Failure checks. If the mask fails, repeat the seal test. Check for hair, clothing, or other matter interfering with the seal. Ensure head harness is pulled down as far as possible. As far as possible. We're going to bring it down. I got a little finger hook just for you. Ensure edges are flat against the skin, so it's not overlapping anywhere. Mission-oriented protective posture, MOP. 5 standardized levels allows unit commanders to increase or decrease levels of protection based on threat. MOP 0. MOP gear is issued, inspected, and prepared for use. Personnel carry their masks. MOP gear is carried or readily available within 5 minutes max. Donning procedures. MOP level 0. JS's chemical protective ensemble should be on hand and ready to proceed to MOP level 1 through 4. MOP level 1. Personnel immediately don the overgarment. In hot weather, jacket can be left open. Overboots, masks, and gloves are carried. M9 paper is attached to the overgarment. NAC and contamination kits are carried. Personnel must wear protective masks, optical inserts, and hydrate. Donning procedures.
No, he's got to put the whole thing on.
Now, you put it all, show I'll put it all in a second. All right, donning procedures. MOP level 1, you have don trousers, don coat, place M9 tape, don helmet, or cover. MOP 2, personnel wear their overboots and overgarment. Overgarment may be left open, but trousers remain closed. Masks and gloves are carried. Donning procedures, MOP level 2, you just add overboots. MOP level 3, personnel wear their overgarment, overboots, and masks. Personnel can open the overgarment jacket and roll the protective mask hood. Trousers remain closed. Gloves are carried. Procedures, MOP level 3, don mask, will look good. MOP 4, so it is going to be total encapsulation. Encapsulation, I was correct myself. Close overgarment and adjusting all drawstrings. Secure hoods, put on protective gloves. Donning procedures, MOP level 4 is in the donning gloves, secure overgarment, Velcro, retention cord, hood draw cord. Dress the MOP 4 within 8 minutes. Doesn't mean actually wait the entire 8 minutes. You can get it done in 2, which should be a record. Do it in 2, but do it as quick as possible. Simple as that. And if that 8 minutes pass, do you just stop? No, continue. All right. Don't do that. I'm so now. Oh, I'm good. No, keep going. Practical application, performance steps. Donning clear mask, don JS list, don trousers, don jacket, adjust secure hood, don cover over boots, and don gloves.